The conference has been really great and exciting. It's really important as a scientist to really come and see what other scientists are doing and what's happening with the clinical trials. And, I think it's been, a wonderful meeting for me, and then I can see that a lot of progress is happening in the kids' brain cancer space. I think the kids' brain cancer space, as I alluded to earlier, really I think is more advanced than the adult in many ways. The understanding of the disease is better. The stratification of the disease is better. So for me, I think it's a really exciting time to be moving into the space. I can see that there's really a groundswell coming now into pediatric brain cancer, and I think we can make big differences. So I think pediatric brain cancer probably is more advanced now in adult in our understanding of the molecular stratification of the disease. I think really people get it when it comes to kids' brain cancer. Everyone here is to have a really honest and open approach to the disease, and you can see there's a real collective to try and do better. So I think that's really led to, I guess, great collaboration around the world, which has advanced the field. That are in the community, and they've done a really exceptional job, I think, of raising the boats, I guess, in the awareness of the disease, the understanding of the disease, and you can really see now that the clinical trials are coming. So I think the next 5 to 10 years is going to be a very important time for children's brain cancer. I think we're going to see some, the build-up of a lot of science come through and actually translate to the patient. I think DIPG has been one of those diseases, I guess, that was put in the too hard basket, but it was one of those insurmountable problems. And I think one of the big issues as a scientist was that we really didn't have access to tissue to understand the disease or models of the disease to actually try and find discoveries. And over the last 10 years, we've seen a really wonderful effort, I think, globally, from charities and families and from the scientific community and the clinical community to really say, well, this is not good enough. And we've seen, I guess, these collaborations now come through, and I think the resource material has come through, and you can see now that we're making great strides in DIPG. So we're all very hopeful that a breakthrough will come. Now is the moment for brain cancer, both adult and pediatric. I sense, I've been in this space for some 15 years, and I think now is really the moment for brain cancer. And I think we have to seize it with two hands, and really step forward and make those discoveries and bring those discoveries to the patient so that we can improve their quality of life.